A silent disease, that's what many call osteoporosis, a debilitating condition affecting 10 million Americans, mostly women. In our continuing look at women's health issues, Lorene Cachola joins us once again to show how osteoporosis can strike with little or no warning and what you can do to prevent it.
Virginia Bonds knows a thing or two about orthopedics. As a member of the healthcare team at Memphis Ortho, she's used to treating patients recovering from bone and joint injuries. So it was a bit unusual when she found herself on the other side of the doctor's office following a stress fracture on her foot. The situation became even more distressing when that fracture wouldn't heal after 6 months. After some testing, Virginia was diagnosed with low bone density. That meant she was a high-risk candidate for osteoporosis, a disease in which bones become fragile and more likely to break. While the news came as a surprise to Virginia, it's no surprise that most women never even consider the risk of osteoporosis.
They did a survey in women over the age of 45, and only 1 out of 4 had ever talked to their doctor about osteoporosis. And it's very important to assess your risk. It is definitely able to be predicted and treated, but many times people don't have any symptoms. Similar to cholesterol, we have to look for it to diagnose it.
Doctors are looking for these risk factors: women over the age of 50 who have a small, thin body frame, those with a family history of the disease, or women who have low estrogen levels or lead a sedentary lifestyle. Excessive alcohol use and smoking are also red flags for risk of osteoporosis. If you are at risk, your doctor may recommend bone density testing.
There are several screening tests available. The easiest that is in some health fairs and a lot of doctors' offices is an ultrasound of the heel, and that is good as a screening test. It kind of gives us a ballpark idea where a woman's bone density is. To more specifically tell a person's risk, if the ultrasound is abnormal, women get a test called a DEXA, which is an x-ray, and it measures the bone density in the spine and in the hip, the two most likely places that a woman will have a fracture.
Doctors haven't found a cure for osteoporosis, but they can prescribe medication and even weight-bearing exercise to help manage the symptoms.
Prevention is very important, and it actually starts very young. In the teenage years, it is very important to have an adequate intake of calcium, and then exercise, weight-bearing exercise is important for prevention. It keeps your bones strong. It also provides you having better balance, so it is less likely that you're going to have a fall when you're older. Avoiding smoking and alcohol are also very important. Smoking leads to lower bone mass, and alcohol intake, anything over 2 drinks a day, has been associated with lower bone density.
Virginia is glad she caught her symptoms in time through a regimen of medication and exercise, and keeping a closer eye on where she walks, of course. She's looking to spend less time in treatment herself and more time treating her patients. For Smart Medicine, I'm Lorene Cachola.